Hi, I'm Dr. Jay Harness with Breast Cancer Answers. Among the many questions that I'm asked, one of the important ones is, gee, Dr. Harness, I have completed my initial treatment. What's next? Well, before I answer that question, let me take this opportunity to thank our sponsor, Breast Cancer Index. It's a test that may help women with estrogen receptor positive, early stage breast cancer to decide with their doctor whether to extend or end anti-hormonal therapy after 5 years. So, what happens after my initial treatment? Now remember, the initial treatment here could be something as simple as a lumpectomy for in situ breast cancer as an example. But for the typical invasive breast cancer, there are other adjunctive therapies. So let's remind ourselves that the therapies typically involve surgery, anti-hormone therapy, may or may not involve chemotherapy, may or may not involve radiation therapy. And if you've had a mastectomy where you're having reconstruction done, there's often 2 phases to the reconstruction. So that timeline of that initial therapy, you see, could frankly drag out to be 6 months or more. But in general, what happens after you're done with all of your initial therapies, and you're now into what some people call the survivorship mode, where we're now looking at years of life ahead of you, and there's a long-term follow-up that's ahead of you. Please remember that breast cancer is a lifelong journey. It takes years to know what's ultimately going to happen, and particularly if your other breast has been preserved, we have to watch that forever. So this is a lifelong journey. Now, fortunately, we've got organizations like the American Society of Clinical Oncology, we've got the NCCN guidelines, we've got other guidelines out there that pretty clearly lay out what should happen during the first 5 years after you complete your initial treatment. You're often going to be seen by your breast cancer surgeon, by your medical oncologist, by your radiation oncologist, and by your plastic surgeon if all these people have been involved. Often for the medical oncologist, it's 2 to 3 times per year during that initial 5 years. For me personally, it's twice a year for the initial 5 years. And in general, most all of us follow the accepted and standard guidelines as laid out by ASCO, the American Society of Clinical Oncology. So remember now, you're on a lifelong journey. There is a set pathway for you, particularly during the first 5 years. You do need to be seen regularly after the first 5 years. So please make sure that you've got an organized, long-term plan for your follow-up. And once again, we'd like to thank our sponsor, Breast Cancer Index. To find out more about your treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your doctor.